primary care providers play a critical role in the long-term care of breast cancer survivors. A recent large-scale study published in the BMJ offers new insights into the actual risk of second primary cancers after early breast cancer. We know breast cancer survivors are at increased risk of developing a second cancer. But until now, estimates have varied, and many patients believe their risks are much higher than they really are. To clarify this, researchers in England analyzed data from nearly 500,000 women diagnosed with early invasive breast cancer between 1993 and 2016 who underwent surgery. Over a follow-up of up to 20 years, about 13.6% developed a non-breast cancer, and 5.6% developed contralateral breast cancer. Compared with the general population, that's only about 2% more for non-breast cancers and 3% more for contralateral breast cancer. For example, a woman diagnosed at age 60 had a 20-year risk of 17% for a non-breast cancer and 5% for contralateral breast cancer. That compares to 15% and 3% in women of the same age in the general population. For a woman diagnosed at 40, her 20-year risks were 6% for each, compared to 4% and 2% in the general population. Treatment modalities also influence second cancer risk: radiotherapy, linked to higher contralateral breast and lung cancers; endocrine therapy, associated with uterine cancer but protective against contralateral breast cancer; chemotherapy, small risk of acute leukemia. Importantly, researchers estimate that only about 7% of excess cancers are attributable to these treatments, and the benefits of adjuvant therapy far outweigh these risks. So what does this mean for us in primary care? Reassurance: we can confidently tell survivors that their absolute excess risk is modest, only 2–3% above baseline over 20 years. Survivorship counseling, tailor long-term screening and preventive strategies especially for uterine, lung, colorectal and contralateral breast cancer. Shared decision-making, provide balanced information. Yes, there are small therapy-related risks, but the treatments save lives. Lifestyle guidance. Emphasize modifiable risk factors: smoking cessation, exercise, and healthy weight, which were not captured in the study but remain critical. In fact, breast cancer survivors themselves, patients who co-authored the linked opinion piece, said these findings are reassuring. They stressed that transparent information about risks should always be available. Not everyone will want details at diagnosis, but survivors deserve the option to access this knowledge later in their journey. The takeaway: second primary cancers after early breast cancer are real but relatively uncommon. Armed with this evidence, we can provide reassurance, individualized follow-up care, and help survivors move forward with confidence. Source: McGale et al., the BMJ, 2025.